Welcome to Business Talk, presented in collaboration with the University of Rio Grande and the Ohio State University South Centers, from the heart of southeastern Ohio at the University of Rio Grande TV studio. Our goals are simple: promote the University of Rio Grande and the Ohio State University South Centers, as well as advocate local small business and their support organizations. More importantly, promote southeastern Ohio as a wonderful place to live, explore, and learn. There are many different ways you can find us. The University of Rio Grande Cable Access Channel 17, live online at blogtalkradio.com, and on YouTube if you are unable to catch our show live. Introducing our co-hosts, Jason Winters, Mike Thompson, Patrick Dengel. Thank you for tuning in. We hope you enjoy the show.
Hey, welcome back to our show. It is really great to have the weather that we have been having. It allows Jason, you to be out in the field and enjoy nature and do the hard work that your wife wants you to do.
I've been in the garden. I've got the garden tan going. I'm feeling good.
I think that's great. I've been mowing lawns. So
lawns, as in plural?
As in lawns, yes. As in plural.
I'm impressed.
Yes. It keeps me active. But, earlier today we were talking a little bit about college life. And a couple of us were sort of discussing what's the whole purpose of going to college.
Do you remember those days, Pat?
It's a very faint memory, but yeah, I kind of remember sitting with a group of people. Anyway, one individual said it's to enjoy a new experience, and another one said to live away from home, and another one said to get a sort of a base understanding of knowledge. What do you think? What's your impression of what college life is like?
3 letters.
3 letters.
J-O-B.
J-O-B.
It's all about the job.
You probably are right on that, because that's the whole purpose. My parents kept on telling me every time I would bring home a tuition bill or things of that nature, hopefully a job. But also on the same token, employers are looking for those quality people. Do you think?
They are.
We have someone here that is working both with the college students and the employers.
But the training you get in college is not exactly what you need in the workforce. Once you get to that job, you're going to have to learn how to do that job specifically.
Yeah, that's true.
And I have a feeling that's what we're going to talk about today.
Well,
workforce development, educating the workforce that are out there to do the job efficiently and effectively.
And we have, I think, one of the best in Southern Ohio that represents workforce development.
He's certainly one of the busiest.
That is true. So it's our pleasure to feature Ian Blache.
That's correct.
Ian
Perfect.
comes to us with a full head of hair. I noticed that some
Thank
of
you
us
so
are.
much.
And it's Blache.
Give him a couple years, it'll take care of that.
Yeah, absolutely.
But
More than you
welcome.
know. Thank you.
Welcome.
It's a pleasure to be here again.
Would you like to tell the listening audience a little bit about yourself?
Absolutely. I actually, just before this, I was in Kentucky helping entrepreneurs, high-tech entrepreneurship, working for the Kentucky Innovation Network. Prior to that, I worked for JP Chase for about 10 years in organizational development. I attended the University of Illinois at Urbana-Champaign, and I was a wrestler. So
You were a wrestler.
I was a wrestler. That's right. I was on scholarship.
Is that how you met your wife?
That is not how I met my wife. I actually met my wife at a Cracker Barrel.
A Cracker Barrel.
Yes.
Where
it's a
you
good
were
story.
wrestling.
Where I was, where I was not having to make weight.
Oh.
Where I could eat because I did not have to make weight.
I see.
Yes.
I see. Let's see. You joined the University of Rio Grande.
About a year ago now.
Wow.
So it's been a fast year. It's been a good year, rewarding year, I think. So I'm really excited about a lot of the projects that we have underway and
Well, there
a lot
are
of the
quite a
accomplishments
bit.
we've had.
Quite quite a few
Well,
different projects.
there's been some personal accomplishments over this last year too.
Yes, if you are talking about a son born on January 23rd, joining my lovely daughter, who is 4 years old, going on 17, as they say, true in her case. And we are also, I'll share this information with the listening audience, have been living with my mother-in-law for that entire year, which has been splendid all the way across the board. And because she is a listener right now. So, but it has been great. And
He also said that off camera. Okay, so
thank you,
Yeah.
Patrick. But we're actually about to close on our house that we
Fantastic.
found. So we have had some stressors, but then some personal
well, I
gains
think
as
that's
well.
great.
Thank you.
Well, congratulations.
Thanks.
And I know that your wife, Robin, is
That's right.
also very actively involved in the University of Rio Grande.
She is. She's the new program director, HIT program director for a grant that I'll probably be talking a little bit
Okay.
about today for a new Jackson Center that we are opening.
I think that's fantastic. That's fantastic. What is workforce development? What do you mean by that?
Workforce development. I said this at Rotary that it's one of those things. I have the last name Blache, and so I've had very interesting mail come in that has pronounced or has spelled my name in different ways, and people say my name in different ways. And also Rio Grande is not said Rio Grande anywhere except in Rio Grande. So this has kind of prepared me for when I tell people what I do, they give me a funny look. And workforce development is one of those things I think that you feel like you should know what it is, but you don't necessarily know all the ins and outs of it. Essentially what it is it's an economic development strategy that focuses on people. And what I love about it is that it works in tandem, holistically, with a number of different resources in the area to both try to enhance and cause the economy to flourish, help the businesses, bring jobs to the area, fill jobs that need workers, prepare those workers for those jobs. So essentially the reason you call it kind of an economic development strategy is that by training your workforce, what you're doing is you're preparing your area for businesses to find it attractive. So one of the first two questions that a relocating company asks when they decide where they're going to put their company, where they're going to call home, is do I have the workforce that's going to sustain it? And so if that's more than just people, you have to have skilled workforce. So a lot of times if you have a company that's coming to town that has a very technical skill that's required, as a university, as a community college here, what we like to do is to make sure that we're anticipating that, and we know that we're going to have to train them in certain things and train up the workforce in the area. So the other thing that I got a very fast education in when I started here, working on a grant, is that it also involves working with different schools. You work with social service agencies. So if you have...
When you say schools, are you talking about higher education, or are you talking
Yeah,
about
I'm
high
talking
school?
I'm talking about both, actually.
Okay.
Because you have the entering workforce and then you have the incumbent workforce. A lot of, career pathways is probably a good, and I actually have a graphic for that, but career pathways is one of the buzzwords right now, especially when it comes to state grants. Ohio's doing an excellent job of supporting a lot of workforce development
So here we have
projects.
a picture of what you're talking about.
That's right. So career pathways, essentially, it's a way of thinking about a person onboarding themselves into a career and then finding a way to continue to work as they are adding to their credentials so that they can come in, get a credential, get an entry-level job, go ahead and work while they are attending school. So as institutions, what we are having to do is to make sure that we have accelerated, flexible curriculum. If we have developmental education needs, that we address them as early and as quickly as possible so that we can advance students into a curriculum without having to waste a lot of time at the outset. Stacked and lattice curriculum is very important. What that essentially is it means that if you have a credential or if you've taken a class and then you work for a little while and you go back to school, that what you've done before will directly feed into the program that you choose to go on.
I think
with.
that's very important. Because employers do look for not only basic skills, but they also look for where you've been and how will that enhance.
Absolutely. And so, kind of taking this grant as an example, it's called the Industry Workforce Alliance Grant. It is funded by the Department of Labor, the Ohio Department of Job and Family Services, and the Governor's Office of Workforce Transformation. Those are the two sponsors in Ohio. And so what we won that grant for was in the arena or sector of healthcare. And so looking at the jobs, I love it the way you started this out, Jason, because when we look at the region, one of the first things we need to do is identify where the existing jobs are and target that first. And when we looked at the Appalachian region, what we saw was that healthcare was far and away the highest growth industry each year, had the most jobs per year being added. And so,
Is that just in our area, or is that throughout the state, or throughout?
Well, it's actually throughout the state. And it's a little bit more pronounced in the Appalachian region of Ohio.
Okay.
And things like the Affordable Care Act and expansion of Medicare, the transition from ICD-9 to ICD-10. We're going to be talking a little bit about coding later. And so ICD-10 and ICD-10 is something that I definitely want to hit on.
We've seen a vast expansion of all the different healthcare that's in our region. I mean, it used to be there was one hospital in our area.
Right.
Now you have 4 or 5 hospitals represented in our local region. So you're seeing a big expansion in healthcare.
It's amazing. Just yesterday at Rotary Club, Holzer had a representative there presenting their hyperbaric oxygen chamber that they use in Jackson for wound care, for healing of wounds. And that's a resource that we have now that we didn't have before. And so, to get back to kind of the subject at hand, we have to make sure that we're preparing our students to be able to enter those types of positions.
Right.
One of the primary, I know that Patrick, you help entrepreneurs, have for a very long time. When I helped entrepreneurs, one of the questions that I found myself asking a lot was, where's the pain? Where is the pain that you see, and how can you fix it? Because workforce development is kind of about identifying gaps, whether it's inside a company, or in a region, or in a curriculum. So you identify gaps and then you work to fill them. So you have to figure out where those gaps are. And so a lot of what you do is you kind of ask where the pain is. And
So where is the gap in healthcare?
so the gap in healthcare, one major gap is in the area of soft skills.
Soft skills?
That's right, soft skills.
What do you mean by
What are
soft?
soft
And
skills?
not all of our listeners are going to know what that term means.
Okay, good. Well,
Like getting up early in the morning to go to work?
That's
Is
hard for some people, so that'd be
yes,
a hard skill.
Yes, it is.
Well, getting up early in the morning.
Coming to
I
work
could tell
is
some.
that-
I could tell some horror stories, honestly.
Yeah.
And I have heard some horror stories from the hospitals and clinics that we have visited in asking this question, and that was a theme that resonated throughout the people that we visited. They said, people show up to work, they're not dressed appropriately. They don't know how to communicate. They don't know how to solve problems. They don't know how to resolve conflict. They come and maybe they have the technical skills that they need, but those only go so far, because what you need to be able to do is work as a team. You need to be able to, patient-centered care is one of the most important principles that we hear it's important to me. I mean, there have been times when I myself have had experiences in the hospital where I was just getting emotional in the hallway because we couldn't get a fan because the something happened on the floor and the power went out. We needed to keep my daughter cold because she had a very, very high fever, and all we needed was a fan. And so when I went and talked to the nurse, and the nurse kind of understood, but didn't see how distressed we were, and also I think was neglecting the basic responsibility that they have to their patient to go get a fan. So anyway, and probably an hour later, I kept saying, I'm going to go myself, and we were in kind of a rural area. There wasn't a Walmart nearby where we could go to. And so I think that the reason I tell that story is that if you can sort of identify that you have a patient, but then you also have family members that are there as well, and they're patients too, because they're going through a very difficult time. And so you first focus on the patient, but then you understand that this is a unit that you are serving as an institution. And so if you do that well, then you not only help your institution, your company, but you also make it a better world. I mean,
that's true. It's like seeing above the forest, above the trees.
Well, absolutely.
And understanding fully. Do you think that sometimes employers don't necessarily feel employees know, or is it the employees just don't care? Or is it a mixture of both?
I think a lot of it comes down to training, Pat. What are your expectations as an employee?
Yeah.
And that's where workforce development comes in. You need to train your workforce as to how you want them to act. What is the mission of the organization? Do they understand what they're supposed to be doing? That their job is not just to, in healthcare example, is not just to administer medication, but to take care of not only that patient, but like you said, the family that's involved as well.
Right.
And those takes communication skills.
Yeah, that's true.
Not everybody that has gone through a nursing program has communication skills. And we find that in other industries. I'm not just picking on healthcare. Mm-hmm. You have that in banking situations. You'll walk up to some tellers and, they know everything about you and, hi, how's your day? How's your family?
Right.
And you walk away. Yeah, you feel good as a customer. It's all about customer service. And there's others you'll walk up, hey, how can I help you? I mean, it's a different environment.
Get better, okay?
Yeah, I know, Pat. We all deal with that. And you see it in the restaurant industries. It really, not everyone's been taught those soft skills.
And that's the thing. It's a learnable skill. It really is. I mean, we're not always born with empathy that allows us to sort of show other people what's going on. Let me put that a better way. We're not born with the skills of how to employ empathy. So there are specific tools. There are personality tests that you can take. There's a class actually that I've put together where understanding your personality and how it relates to the 3 other types of personalities will allow you to better communicate and understand other people. So it's a learnable skill. It's something that if you take a 1 or 2 day seminar can cause great advances in your ability.
I was just looking at some of the training. Mm-hmm. You have leadership, customer service, conflict management, communications, on and on and on. Denials management. Mm-hmm. That would probably be interesting.
So those are the soft skills that we're teaching. But also there's some real hard skills that we need in this region, specifically to healthcare. And we might even back up a little bit and talk about our new venture, the Jackson Center, and how that's going to reach those soft skills and also those hard skills. So why don't you tell us a little bit about the Jackson Center?
Great. Okay. Well, it's, I think I have a slide.
Do we have a slide? The Jackson Center.
I'll just tell you a little bit about it. I'm going to go ahead and tell you the.
Under workforce development or seminar?
It's well, I just want to announce the address. So first of all, it's at 14761 State Route 93, Suite 1. It's right down the street from Walmart on Main Street in Jackson.
Easy to find.
It's the old. It's very easy to find.
Yeah.
It's very well trafficked. It was the old Marilat Transition Center.
Yeah.
For those who are familiar with that. So basically, in identifying some of the gaps in health career pathways, one primary one that we are focusing on right now is coding. Rio Grande has not had a coding class that leads to a certificate. Coding.
I'm not sure what you
So
mean
medical coding is ICD-9 and ICD-10. So basically, all of the procedures and all of the every time you go to the hospital, basically, there is a code, and it's a international classification of disease, and it's a number that's associated with that.
I see.
That says, this is what you get paid for, basically. And that's why it's so important. That's why going from ICD-9 to ICD-10, which is going to increase the number of codes from roughly 18,000 to about 140, 150,000 codes.
So if I went into a hospital and I had an X-ray, there would be a certain kind of code.
That's right.
That
That's
would.
right. And how you came in, if you came in with having had a ski accident, or if you came in
I
with a
see.
dog bite, those are all coded differently.
Oh, okay. All right.
And
And I didn't realize
And
there were
that's
that
tied
many.
to federal reimbursement for healthcare?
absolutely,
Oh.
it is.
Then it's
it
kind of
is.
important.
It's kind of important. It's kind of important. I think there's been a bit of misunderstanding, and I think it's starting to clear up now. First of all, ICD-10 will happen in October of this year. It's been delayed. It's been delayed. We are the last industrialized nation to incorporate ICD-10. Several other countries are already on their way to ICD-11 to implementing that. But so basically, it's not like you pay a fine. It's not like if you don't have systems in place for doing this, you pay a fine and then you don't worry about it. You don't get paid. So there are studies that suggest that there will be several medical practices, foot doctors, hospital offices that close because they aren't familiar enough with the transition to ICD-10 to be able to bill correctly. And so they won't be getting paid, part or all of what they need to be paid. So we actually have a transition class for that. So any hospitals in the area, we can do a couple of things. We can actually go on site and do a 2-day seminar, do a 3-day seminar that takes all the way from registration to the doctors themselves, and helps them understand where the impacts are going to be and what they have to do to prepare for being paid, basically. So I'm glad you asked the question that way. So coding, and that all kind of ties back to medical coding and an understanding of what that process is. And so beginning June 1st, we are offering a new medical coding class at the Jackson Center that leads to, this is another exciting thing about it when you talk about career pathways, it leads to a number of different health administration pathways as well. So you have coding, compliance, physician practice management. There are other interesting things that you can do. But so if you are interested, if anybody out there is listening and is interested in exploring more about the coding class or some of the other allied health courses and patient care courses that we will be offering beginning in the fall or even earlier at the Jackson Center, then I definitely encourage you to pay the location a visit or to call this phone number.
740-577-3555.
That's right.
Or they can reach you here at the University of Rio Grande.
Yep.
I Blache.
Yep.
I Blache.
IBLACHE at rio.edu.
So Ian, there's actually jobs waiting on graduates of this program.
Absolutely. One of the things that we're focusing on is leading folks that take our classes to getting certifications.
Okay.
But we've been told specifically by hospitals that they are hiring coders even without certifications. So that's how in need they are.
So let me ask a follow-up question. We have listeners that might be interested in this. Obviously there's jobs waiting for them as soon as they finish the certificates in the program. what kind of prerequisites do they have to have? I mean, it's an important job. What kind of skill sets do they need before they even take the training?
We have really, the best way to approach it is to come in and have a discussion, is to talk a little bit at the center, and let's explore that a little bit. We're trying to create an opportunity for people that don't have any background to be able to enter this pathway.
Sure.
And one way that we're doing that, one strategy we're using is, in addition to the academic pathway that begins on June 1st, is a boot camp. So we're basically taking 2 coding classes and we're combining them with the expertise of our program director to allow, after about 3 months, for you to be able to have the requisite knowledge and also the kind of understanding of what the test entails in order to take that test. And in addition to that, what we've also outfitted the center with is a computer lab and some online tools for studying, taking practice examinations, and tutorials for allied health courses such as coding, and also patient care courses such as CNA and others.
Ian, you're going to have to come back and tell us some of the successes that you've been doing. You might next time bring Robin, your wife, who's leading the charge.
I will. I'd love to come back. There's several things I didn't get to talk about. So.
I understand.
The time went quickly. But
oh, yes. We would like to have you back on.
But Pat, before we leave, let's give that contact information one more time for our listeners
Sure.
who might be listening to that.
More information, it's 740-577-3555 or iblache@rio.edu.
And if there is a listener out there who doesn't have their diploma, one of the things I was going to talk about today is how you can get your diploma through taking classes that will get you to work. So
Okay.
if you're interested, call that same number, contact that same information.
Sounds like a fantastic follow-up
Yes.
show.
Later on today, Jason, we have Tom Harker. Tom Harker comes from Ohio State University South Centers, in which he's a research assistant. He's the person that does all the work that the researchers say they're going to do. And so we wanted to pick Tom's brains about what it's like to be a research assistant. We also have at 3 o'clock show, Dr. Dan Remley. He's a food nutritionist. You know, Jason, every time he looks at me and he looks at what I'm eating and what I do,
He just shakes his head.
Shakes his head and just walks on. So it's a pleasure to have Dan Remley on with Dr. Tom Worley, who's going to lead the charge. So looks like we have a really good set of shows now and then upcoming. So
Ian, thank you for joining us today,
My
and we'll look
pleasure.
forward to having you back.
Thank you very much for having me.
I'm Patrick.
I'm Jason.
I'm Ian.
Thanks for listening.